Okay, so now let's get to the part where you all are here for, getting to know the speakers and the content of the day. Before I introduce Dr. Blatherwick, I'd just like to introduce, just say a few words about why this town hall now. So we're a collective of people who basically believe in giving IMGs or doctors who've been trained internationally the rights and dignity to be able to practice in BC. I mean, most of you are pretty familiar with this, and so I don't want to spend too much time on it. But right now we're in critical need of doctors, partly because of the pandemic, but also before the pandemic. Many of us have struggled to find family doctors, and we also know there's more than 30,000 surgeries that have been canceled because of this pandemic or postponed. So there is clear need for doctors here. And also it's also obvious that we have so many talented and skilled doctors who are trained and more than qualified to be able to work, but are unable to do so due to some, I don't know, barriers that are unreasonable, and that we're hoping that they could change and make it easier for internationally trained doctors to be able to practice here. So at this point, I'd like to just introduce and pass it over to Dr. John Blatherwick. He has served for 37 years as a medical health officer in British Columbia, the last 23 as the Chief Medical Health Officer for the Vancouver Coastal Health Authority. John has received the Order of Canada, the Order of British Columbia, the Order of St. John, and honorary degree from the University of British Columbia. Obviously a man with lots of expertise, and we're so lucky to have you join our call and be part of our supporting our campaign from the get-go. So without further ado, Dr. Blatherwick, please take the lead.
Okay. Basically, I find myself addressing you for the simple reason that early in my career, I had a lot of doctors coming to talk to me about how they could get their credentials in Canada. And in my early years in Vancouver, I had some sources for them. Newfoundland used to still take international doctors, and so I had some people they could contact in Newfoundland. The Manitoba Northern Medical Health used to take them, and I had some places in Saskatchewan. And usually in Saskatchewan, I could also find internships for these people, which was what most of them were looking for. Slowly but surely, that all dried up, and there was very nothing that I could do for these people. There wasn't any place I could send them. The government created a few positions for internships and for residencies for international doctors, but not nearly enough. And every time we ended up talking about this, people would sort of say, well, we don't have the money. And it was always a money issue, which just used to annoy me because I knew this wasn't a money issue. This was just blasted, you don't want to do it. So I retired in 2007. I haven't been in this game for a while, but my daughter-in-law is a trustee of the Coquitlam School Board, and one of her friends had been talking to her about international medical people, and she said, well, John knows something about this, talk to him. So we got talking, and the simple thing is that all of a sudden, money's not an issue, right? So we can spend money giving people $2,000 a month. We can spend money bailing out various industries. And so the question was, is this a good time to bring this topic up of international trained medical people? And the answer is, this is a wonderful time. The Minister of Health has announced $270 million to get rid of the backlog of all the surgeries and that they have had to cancel because they decided to keep the hospitals available in case the COVID-19 cases got overwhelmed them. So there's a whole bunch of money. But the thing is that we know that you can't throw money at the medical problem. We know that throwing money at the wait lists has never worked for the simple reason There's a finite number of surgeons. There's a finite number of anesthetists. There's a finite number of nurses. There's a finite number of care workers. And mainly, the hospitals didn't have the money to do more operations. And so now that we've gotten into this 30,000 backlog of cases that we canceled in the last 2.5 months, we're going to try to throw money at it. Well, this is why this is a good time for your organization and for the medical organizations and that of international trained people to say, okay, we're here. You need people to do these things. You want to throw money at it, we're here. And if you also want to solve this problem once and for all, instead of having us knocking at your door on a regular basis saying, you know, you've got all these trained people, why not use them? This is a great time. It always frustrated me that somebody in some other country paid to have the training for you people, and then you came to this country, and instead of us saying, wow, what a great deal we've got here, we turned around and we said, oh, here's all the barriers you have. And by the way, you have to find a position that doesn't exist. So that was my pitch really to the doctors. That's my pitch to this group, is that this is a great time, because right now they can't give us the excuse that there's no money. There's plenty of money. So this is why it's really important to talk to your MPs, talk to your MLAs, talk to your local politicians. I once asked a good friend of mine who was the premier of this province at one time, why didn't you do something when you were the premier? And he said, I didn't think of it. I said, but you obviously knew about it. He says, yes, because when I got involved in federal politics, I found out a lot about it. So that's my message to you, is this is a time to put all your pressure onto your own MLAs. Each of you should be talking to your own MLAs. Each of you should be talking to your own MPs, and collectively you should be talking to them. And all the things that you have been told why they can't take care of you, why they can't use your skills, don't make any sense now. We need them as Canadians, so let's get together. So that's all I got to say.
Thank you so much, John. My name is Paula Ardilis, and I am going to be the moderator for the next part of the session. And I just wanted to say thank you, because the words coming from you, somebody that's very established here in the system, is very important to give us hope. There's been a lot of people that have been supporting the Train to Save Lives campaign. And I just wanted to say that we need allies like yourself to be vocal and to be present in these kinds of conversations to help move this work forward. So we very much appreciate your solidarity, and we look forward to continuing to work with you on this very important issue moving forward. So thank you so much on behalf of all of the committee.
Thank you.
I also just wanted to say a quick thank you, because Nada was very modest, and she didn't share that she's, and with Amir, both of them, that you can see them on camera, have been really important forces of organizing and mobilizing this group. And so I just wanted to say thank you to both of you, in particular to many other people that are on the call. Abir was one of the people that unfortunately couldn't make it today, and she's been incredible. We've had graphic designers, artists, people on social media, a lot of different volunteers. So I can't name them all, but I wanted to say, if you're on the call and if you're going to be listening to this recording later, that this collective effort is only possible if we all mobilize together. And so really appreciate everybody stepping in whatever capacity you've been able to do so far to make this happen. I'm very happy to be able to contribute a little bit today and support the moderation of a fantastic panel that we have. So I just wanted to explain a little bit. We have 4 panelists that are going to be speaking from their experience. They're all internationally medically trained professionals, and I've prepared some questions for them, and we're going to do the 4 panelists, and then we're going to take a 5-minute break. And then we're going to open up the possibility for the people that have joined us to be able to participate and ask questions and also make comments. So that's basically how the rest of the agenda is going to go, and we will finish promptly at 7 o'clock today. So I'm hoping that the break will be around a half-point part, around 6:15. Okay, so without any further ado, I just wanted to introduce myself. So I'm Paula Ardilis, and I am a lecturer in the Faculty of Health Science at Simon Fraser University. I'm also the co-founder of Bridge for Health Cooperative, and really happy to be a volunteer here with the Train to Save Lives campaign. My first panelist that I get to introduce is a dear friend of mine, a colleague, Dr. Patricia Maecha, and she is a physician surgeon from Colombia. She studied epidemiology and hospital management. She made a refugee claim and came to Canada in 2008 as a permanent resident, and she immediately started the process of recognition for the International Medical Graduate in 2011. And she has lost everything due to her migration process, and has really been doing a lot of different attempts to reinstate herself as a physician, and she has been working a lot with refugee claimants and people with HIV in her many different roles. She even went back to study at SFU and graduated with a Master's of Public Health in 2017, and that's where I had the pleasure of meeting her. So Patricia, I really wanted you to share your experience in terms of how difficult it has been for you to be able to actually find your place here in Canada. And I was very curious to understand a little bit in terms of why you've decided to retake the process of recognition. If you can tell us about your personal journey, just to set the stage, I think that would be very helpful, especially for all those that are on the call that haven't had that personal experience. We would really like to hear from you. So I'll turn it over. And Patricia, you'll have about 5 to 10 minutes, and then just let me know, and we'll close it off, and we'll go on to the next panelist. Does that work? Okay, thank you. And I think you're on mute. Okay, so I'll pass it over to Patricia. There you go.
Sorry.
Yeah, we can hear you now. Yeah.
Okay. Hi, and thank you, Paula, for the introduction, and thank you so much to everyone for joining us. Yes, I came to Canada in 2008, and in Colombia we speak Spanish, so I learned English, but I never practiced it. So I had to start studying English, and the settlement process that was not easy when you are leaving your home, your family, your work, your life. So I started the process of settlement, and I started the process of recognition in 2011. And it was so difficult because I had to work for living. So working at home and studying, I couldn't do it. So I decided, or the life decided, that I have to work, and I continue working. So I tried to get some jobs that were in relation with medicine. So I started to work as a volunteer with the Canadian Red Cross with the monitoring, with the detention monitoring program as a health delegate. So we went to many jails to visit refugee claimants to see how the health system were into the jail with refugee claimants. And I started to work with refugee claimants at settlement orientation services, so I could help refugee claimants to navigate into the system. And after I work with people with HIV in AIDS Vancouver, so I help them to navigate the health system. and to navigate the social organization that could help them. In 2015, I decided that I needed to study something more in order to improve my knowledge, in order to improve also my English. And I decided to start a master's degree in public health. So I went to SFU. Studying at SFU, I work with indigenous people, and I work as a research assistant with the Health Change Lab. This is the course that Paola does. And when I was working in this course, the course looked to resolve public health issues in Surrey through community engagement. So finally, I was working as executive director at the Strathcona Health Society, and this is an organization that helps people in low income with dental issues. And now I decided to restart the process because I feel that I am ready. And really during this pandemic, there is a lot of frustration because we have all the knowledge and all the willingness, and we couldn't do anything. And there are many people with a lot of knowledge, a lot of experience. We cannot do anything as international medical graduates because there are many barriers.
Thank you so much, Patricia, for getting us started with that testimonial. And just to recap, I think that you commented how you have had to do several different types of jobs here upon your arrival in Canada, including many volunteer positions. You also went back to graduate school and served as an executive director in the dental clinic. So you certainly really have been doing a lot of work in order to get back into your practice. And we really want to say that we support you, and we look forward to hearing more. But I think one of the things that you brought up that's very critical is in terms of the language barriers that you've faced, and how also the process of recognizing your medical skills has not necessarily been the most fair for you in terms of the your language acquisition. And I think that that's an important thing to note, that many people that take the exam, that the English exams, they might still have an accent even if their English is very good. And so that's something that we need to be thinking about in terms of how people might be facing discrimination in the system because they have a heavy accent, even if their English is very good and they've passed the exam. So I just wanted to recognize that, because I know that it also has an impact in the workforce in terms of just even the hiring processes. So it's just an additional barrier that is faced by many. Okay, well, I am now have the pleasure of introducing Dr. Naveed Puyan. Naveed is an immigrant medical graduate an immigrant international medical graduate who did his residency at UBC St. Paul's Hospital. And he is currently a family physician working in the Coquitlam community. And the question that I have for you, Naveed, is what are the shortages that we are facing right now in terms of medical specialties and primary care? And how do you think that international medical graduates can be a solution for this shortage? I'll turn it over to you. Thank you.
Yeah, thank you so much. Hi, everyone. As Paul mentioned, I'm a family physician in Coquitlam. So I think there's no one better than a family doctor to be asked about the shortage, because we not only can comment on the shortage in primary care and family doctors, we can also clearly comment on a shortage in many different specialties. it's very, I think the shortage is very obvious to everyone, but unfortunately sometimes it can be denied by health authorities. The evidence is there. I can tell you exact evidence here that I just got it from the Division of Family Practice of Northwest Fraser Health, which is the area that I'm working in Tri-City and New Westminster area. They told me that they have 42,000 unattached patients that they don't have a family doctor, and significant amount of them are actively seeking for family physicians and they cannot find it. And actually these statistics are worse right now because most of it are coming from 2017, and many doctors since then retired. And 50% of these family doctors are actually have been in practice for more than 25 years. So we're expecting so many of them retire pretty soon, and the situation will be worse. Same thing, same statistics, even worse we're getting from Vancouver, which I think it should be make us worried, because if we don't have in our urban area, in our central area, we'd have such a shortage, it means that we will face more problem in rural areas and smaller communities, because it's always easier to transfer patients from smaller communities to central areas. But what if we have shortage in our central and urban areas? Then what we should do? And everyone knows about long waiting for the surgeries, and now it's even worse because of the backlog surgeries because of COVID-19 crisis. As I said, it's very easy to ask a family doctor and they can tell you about the shortage in all the specialties. Like when I refer patients for a neurosurgeon, easily, we won't be surprised that we get an appointment in a year, or if even longer, or many other specialties. Like I have a very good example. I had a patient, a chef, that had a very, very bad bilateral hip pain, and he couldn't work. His wife had a cancer. He was going through a very difficult time, and he couldn't get his hip replacement less than a year and a half. I don't think that's a good standard for our community or as a country, as a nation. In the past, I was saying, I was always speaking up, but I was speaking up as a voice for immigrant physicians. I myself came as a skilled worker. Most of us came through the skilled worker program. So they told us that they need doctors here. We came here. We were shocked that there's no work for us. They don't let us in. And but right now I'm saying it's not even about the immigrant physician. It's about community. It's about public. It's about the safety of the public. It's about the quality of life of the Canadians. It's not about only the immigrant physicians and their rights and discrimination anymore. It's actually right now it's about Canadians. Canadians are not getting the good standard of care that they deserve, and I think immigrant physicians can be a very, very good solution to that. Government had tried to, for example, find some solutions around it, like increasing the nurse practitioners. And I think these new class for immigrant physicians could be a big solution for it. In Ontario, we had Alberta had some similar positions to this new class of associate physician. Still, we don't have much information about it. It should be defined, but I think it's a good start and can help the community. It can help with the virtual care. It's something that was experienced in Ontario. Like physicians, they were doing virtual care, and physician assistants were doing the physical exam for them. So one physician could handle lots of virtual care with good safety, because there was a physician assistant doing physical exams for them in multiple clinics, this could work in here too. But at the end of the day, I think there should be a transition from associate physician position to getting full license for the people who can show their safety, who can show their skills, they can show, improve their knowledge. Yeah, I think it's a very good campaign, and immigrant physician could be a very, very strong solution to the very bad shortage that we're facing. And and everyone expecting that it gets worse because in the future more doctors will retire, and the population is actually aging, so we will need more and more healthcare. So this situation will get worse, and we can see how critical it is when a crisis like COVID happens. Imagine if we get a second wave of COVID. Our system definitely cannot tolerate a second wave of COVID, which could be even worse than the first wave. So I think it's the time that we should start thinking about the solutions, and definitely immigrant physicians can be a very, very, very bright solution to this problem.
Thank you so much, Dr. Naveed. I think you brought up some very important points to note, and I think that what I wanted to kind of just summarize is in the fact that this is not an issue only for immigrants population. It's actually a Canadian society issue, especially because of the issues that you brought up around the standards of care, and that with our aging population, this example here of COVID is just one example of the many challenges that we're going to be facing. And, you know, Dr. Bonnie Henry has said just today that there will be a second wave. We know that. And so how do we best prepare, and how do we support these medical graduates in order to achieve their full licensing now in a time that's so critical, but also preparing for the future? So I think that your comments are very well taken. I am going to now turn to the third speaker, and then after she speaks, we'll have a 5-minute break. And then we'll go on to our final panelists, and then we'll open it up to the rest of the participants. So I have the pleasure of introducing Dr. Katayun Ranavardi. She's a family physician working in a clinic in Vancouver and a few long-term facilities in the North Shore and West Vancouver. She's been practicing in BC since 2013, and before that in other provinces, Manitoba and Nova Scotia specifically. And so the question that I have for you, Doctor, is what are some of the problems that you have seen in terms of the assessment, and how do you think that we can actually achieve a fair and clear and effective assessments for internationally trained professionals?
Thank you very much for the introduction, and thanks for the organizers to give us this chance to speak to the audience, and thanks for everybody who's joining us today. I will give you 2 examples as what the problems are as the barriers. One, the most important one is the rules of the college. When I moved to British Columbia in 2013, I was asked to do an English exam, and that was while I had my CCFP, and I had a work experience for 7 years. But that was the rule, and no matter how much I tried to explain that this, you know, and the English exam that I did was 15, 20 years ago when I first got to Canada. So I had to do the English exam, which was not done right away. And then I had to do the certificate of good standing again because it expired. And then the person who was dealing with my file went on vacation. So all these things for me, who already had CCFP and had practice for years. And the other one problem in the system, I would like to refer to the recent license, the issuance of the associate physician license, the restricted license that the college is going to provide to IMGs. And one of the criterias is 24 months of postgraduate training, which is not the mandate for a lot of international medical schools. But a lot of these qualified physicians have several years of work experience, which could well fill up the gap of this postgraduate training. So right from the beginning, a lot of these doctors are not able to be assessed. So these are the barriers that we see. But what we can do, still, we have to communicate with the college. The college has to decide. And what I would suggest, which is necessary but not enough, would be to communicate with the college, with each other. We need to listen to the college carefully, honestly see what we're required to do, and then while we're doing that, to express our issues when there's really a roadblock, like the ones that I named. And the best way to do that is to do it collectively, together. If we want to write a letter, to do it together. So it's very important not to stay home and just study this medical knowledge. We have done it already. And we need to improve our English language for sure. We need to communicate. We need to learn the culture. We need to learn the healthcare system. And we need to be active and get to work, especially in the field of medicine, to gain some confidence, to get to know the environment. And then when it's necessary, when there's an opportunity like this one with the COVID, then try to approach appropriately and together and go forward. I know that with good effort and hard work, a lot of you, I hope all of you, can succeed. But I would also suggest, if you couldn't get anywhere with the college here, try to broaden your option and try for other provinces too. Thank you.
Thank you very much for all that wisdom that you are sharing with us all here. And I just wanted to reinforce the thing that stood out for me is in terms of the staying active and the communication piece, which I think that at least here in BC, you know, if you are interested in joining this initiative, Train to Save Life campaign, we do have a Facebook page and we're using a hashtag on social media, hashtag Train to Save Lives. And that way, you know, we can stay connected. And I think there is a lot of more power when people are united on this front. And so we need a lot of hands on deck in order to make this happen here in BC. So if anybody's interested in supporting volunteering, please do get in touch. And for, you know, that's, I think, one of the really critical things that you spoke to in terms of the communication piece as a tool to really help advance. In the meantime, people are, you know, trying to do all the other things that they need to be doing in order to stay current with the medical knowledge and the English proficiency testing. So thank you very much. I really appreciate it from your experience. We are now at a time to take a 5-minute break. and then we get to come back to hear one more panelist before we open it up the discussion. Okay, so we are now going to be going to the second part of the town hall. It's 6:20. And so I have the pleasure now of introducing our fourth and final panelist today. And it's going to be Dr. Vahid Nilforushan. So he has served as an assistant professor of anesthesia at one of the major universities in Tehran, Iran, before coming to Canada. He's passed all of the required medical exams in Canada and the US, and he has been to residency interviews in both countries but has not been matched. He did research and clinical practice under supervision here in BC and is currently training other international medical graduates to pass the clinical skills exam. So thank you so much for all your support and for being here today. We have so much to learn from you. I would want you to comment, please, in terms of what you think are specific things that we should be keeping in mind in terms of the effective and fair assessment for IMGs. And also that we recognizing that there is an increased need for surgeons and anesthesiologists in BC because of the surgery backlog. And I was wondering if you could talk a little bit about that and share your experience, please. Thank you.
Sure. Thank you very much. And hello, everyone. So I'm going to break the discussion into three parts. First, I'd like to tell you a few short stories about myself. Then I'm going to talk a bit about the fair assessment. And lastly, I will touch on the issue of increased need to surgeons and anesthesiologists in BC. So my short stories, unfortunately, might be discouraging to many IMGs, but I think that it's essential to discuss this because I think it might lead to some changes in the system. I had several achievements in Iran before immigration. For example, I stood first in the whole country in the National Board Examination of Anesthesia when I took the exam. I pioneered a method for opioid addiction treatment in Iran, which led to the establishment of the first inpatient addiction treatment center in the country. When I applied for immigration, Canada was expediting the process because Canada was actually competing with Australia in attracting talented people, and there was a need to physicians in Canada. However, 10 years after immigration and after doing everything that you can think of, I am still not able to have the opportunity to provide care to the people in need. And I don't know why. Sometimes people ask me, have you failed the exams? Sometimes they advise me to do this and to do that. And I tell them that I had done all of them. So these experiences are very frustrating. About 7 years ago, I was doing the clinical assessment program in BC. My supervisor, who was a family physician, was very satisfied with me. She told one of her patients that I'm sure that he would be in the system, but I'm not. Around the same time, I talked to another family physician. He told me he was aware that I had done the exams and I had also done volunteering, research. He advised me to work on my profile, strengthen it more. So I did more volunteering. I did 3 years of clinical traineeship in BC, 2 years of which was at Vancouver General Hospital, over 2 years. I had excellent reference letters, but I wasn't successful. I asked another family doctor, and he advised me to talk to the program director, but I was not allowed to. Some of the nurses that I worked with at Vancouver General Hospital said that they wished that I was their family doctor. Also, my supervisors at VGH were very satisfied with my performance. You can check out their endorsements at anesthesiahotline.org, which is another project that I've been working on for many years. I hope that this doesn't come across as arrogance. I'm just telling these because I feel responsible to the public and to IMGs. I want to see some changes in the system because this system is defective. No one is really benefiting from this. And I'm not the only example. There are many other highly qualified IMGs, and many of them have passed the exams. And unfortunately, the main argument is that we are a concern to the public safety, but that's not applicable to many of us. We have not just been given the opportunity to prove our competence. There are many physicians from certain countries who are given training positions without passing any Canadian medical exams, just because their countries pay for the positions. Why aren't they required to prove that they can provide a safe and effective medical practice? Why aren't there any barriers for them to get the training positions? So, yeah, that's my story. And in terms of the assessment, fair and effective assessment, or I would say logical assessment. Dr. Ranavardi talked and mentioned very great examples. So a few other things. Those who pass the Canadian medical exams and get the licentiate of the Medical Council of Canada, like me, are able to practice conditionally in Australia, which has very high standards of practice. But the LMCC is of no value for practicing in Canada. Also in Australia, you can take the IELTS test and get the 7 in different modules in over one intake within 6 months. But in Canada, you need to score 7 in just one intake. I've seen many IMGs. They got 6.7 in speaking in one intake, in another intake, 6.5 in writing, in the next intake, 6.5 in listening. So they have just been wasting their time. And there is no assessment for specialists, especially in BC. In terms of the need to anesthesiologists and surgeons in BC, as we discussed, there are 30,000 non-emergency surgeries which have been postponed because of the pandemic. Now the total of the patients who are waiting for surgeries is around 93,000. These patients have been waiting for surgeries for a long time. Dr. Navid mentioned, yeah, so many over 1 year. And that doesn't include the time that they spent on getting a referral to a specialist. the government is saying that it will take up to 2 years to clear the surgery backlog. So there would be more pain and suffering and stress for patients. Many reversible conditions become irreversible or lead to disabilities over time. And of course, cancer is not stopping during the pandemic. Many of these patients are suffering from cancer. And this issue has been going on for a long time. Now it's worse. The government is saying that they are going to hire more surgeons and anesthesiologists. As far as I know, there has been a shortage of anesthesiologists for a long time in BC, and that led to the closure of some operating rooms. So I'm not sure how the government can find anesthesiologists to add to the system. And also, they're planning to ask the surgeons to work longer hours and on weekends. And it's very hard to practice safely with a greater speed and with a greater workload. Also, there is a limit to the operating room's capacity and hours. So that doesn't seem to be a practical solution. And even if we can increase the number of surgeries in a shorter time, there would be more need to physicians on the hospital units to take care of patients after surgeries. And it seems in the restart plan, there is a need to other physicians and specialties as well. And of course, I think that IMGs can be a part of solution. There are many highly qualified IMG surgeons, anesthesiologists, internists, and general physicians who can help. If physicians from some certain countries can get training positions without passing any Canadian medical exams, why IMGs who have passed the exams, why they cannot help? Also, there is a group of family physicians. In Canada, it's called family anesthetists. They do 2 years of residency in family medicine and 1 year of fellowship in anesthesia. And they can anesthetize many patients independently. But IMGs like me, who have done 1.5 years of internship, 3 years of anesthesia residency, 13 years of anesthesia practice, both private and in the university, and passed all the exams, we cannot. We cannot even practice under supervision. We cannot even go through any assessment. There is a program in Manitoba and Alberta to assess specialists. There is nothing in BC. We can have these programs in BC. There was a program in Ontario called CEPIA for assessment of some of the specialties until 2010. But it was removed, and we can have this in BC as well. Sorry, it took very long. Yeah.
Dr. Vahid, thank you. I think it was really important to hear the different levels of barriers that you had to face. And I have been following a little bit in terms of what's going on in the chat. And a lot of people are very much agreeing, hearing your frustration. And it seems that it's something that a lot of people are sharing. And that importantly enough, it's, I think that there's a comment here from Raj saying that it's really important also that we think about advocating and thinking about mobilization and how do we actually look for solutions. And I think that part of getting to a solution is really understanding the problem and really understanding the different types of barriers that people are facing. So I really appreciate you sharing your experience and your advice with us. And now I would actually really love to have the participants. We have until 7 o'clock. So the first thing that I think we'd like to do in order to engage the rest who have been listening, and we know that there's a lot of experience and a lot of expertise here on the call. We'd love to hear from you. So the first thing that we are going to do is just have a short poll, and it's going to be going out now, that we can answer, just so that we know who's in the room right now. We'll give people a couple of minutes. Okay, so there's an overwhelming majority of people who are not able to practice in Canada that are on the call. Also, the majority of people, more than 80%, are based in BC. And the majority are also immigrant medical graduates. We're just a few more seconds until we have about 30 seconds before the poll closes. Okay, it went back to 41 seconds, so I think we closed it. Okay, great. Yes, so thank you everybody for answering that. We also have a survey that we would love for you to fill out. If somebody could please post it on the chat form, making sure that we have people respond to that before they leave the call, that'd be really fantastic. And so what I would like to do now is actually turn it over to the participants. And I think the question that I would like to ask is that we heard a lot about the barriers of integration of IMGs into the system in Canada. And so what I'd love to hear are actually success stories or ideas, suggestions in terms of not only how the system can be improved in terms of this integration, but also how we can be better advocates in terms of actually pushing forward this agenda. So we know that it's something that's not just important for IMGs, but for all of the society that right now is facing a lot of challenges. So what I would love to do is focus on those two questions. So integration of the system, success stories, and based on your experience, like what do we actually need to do in order to better advocate for the changes that we are all talking about today. So what I would love is if you could actually raise your hand. I think that's a function here on the chat line, and Farzan is helping us with the tech part of it. So Farzad, is there any instructions for people in terms of how they can raise their hand to so that we can call them to speak?
Absolutely, yeah. So feel free to just write it in chat, or there's a button for reactions. You can react either of the reactions, and I will be able to.
Okay, I see somebody, RE, initial RE. Please feel free to join us with a comment or a question for the panel.
Hi, thank you very much for organizing this. I have a question. Like a resident, myself being a resident of BC, I'm not allowed to, apply for counts in other provinces except Ontario, because all other provinces say it, either they have a condition to be a resident there for at least 6 months before you are eligible to apply, or they stated that they prefer the resident, frankly. So BC gave 50% of the spots for other IMGs from other provinces. I agree with this attitude, but I just wonder if BC does that. I think it would be fair for us also, BC resident, to be able to apply for other provinces. So I wonder what is your thoughts around this?
Thank you so much for your question, and I will turn it over to the panelists if anybody wants to answer. Just make sure you take yourself off mute.
I didn't get the question clearly. What I heard is that you cannot apply to other provinces. Is that?
Yes, that's correct. Yeah.
Why is that? That's not correct. We had some people that they match in Ontario, Ottawa, or I don't know, like in Saskatchewan. I know people from BC, they applied there and they could match there. So
maybe I don't have your name, but your initials were RE.
Yes,
for
yeah, I'm here. Sorry, I couldn't unmute myself. I am talking about Alberta, for example. You have to be a resident there for 6 months at least before you apply. I'm talking about Saskatchewan and
Saskatchewan is not like that, but Alberta and I guess Newfoundland is like that too. Alberta is there are very few provinces, but most of the provinces actually you can apply. And actually, BC residents recently, they IMGs, they match a lot in Ontario, especially immigrant physicians, because BC is now moving toward the fact that they want more recent graduates. So now recently IMGs, actually immigrant physicians who have, they're kind of old graduates, they have a higher chance of being matched in Ontario. So over the actual last 2 years, immigrant physicians of BC, they're getting matched more in Ontario rather than BC, which is kind of unfortunate that BC is not paying is not considering value for the experience, and they're just looking for the recent graduation. But yeah, I think other than Alberta, and I guess there's one other province, you can still apply, and Ontario is actually a good chance.
Okay, thank you for that. I think that there's also probably a lot of changes due to COVID right now in some of the provinces. So yeah, we'll stay tuned for those changes. Thank you very much. So does somebody else want to raise their hand to ask a question or make a comment?
I want to mention something about the associate physician class. So we are following up on that with the college and the Ministry of Health. And those of you who want to get an update, please fill out our survey, the short survey. We will put it in the chat box. And also those of you who are interested, if there is any progress for anesthesiologists, surgeons, also please just fill out our survey.
Thank you very much, Dr. Vahida. And also, just remember also that there are things being posted on social media. So the hashtag is Train to Save Lives again. And that's how you can find out more information about the particular campaign here in BC. Okay, I have a guest here. I'm going to try to see if I can pronounce it. Suvash Poka. I will unmute you. Okay, let's see. Oh, maybe I could get, oh, there you go. I think that you can speak now.
Hi, can you hear me?
Yes, we can. Thank you.
Yeah, thank you very much. I'm from Ottawa. And as I came to know lately that the British Columbia is planning to give some sort of like a physician associate or something like that. And my question is that for that, do we need to be the resident of British Columbia, or we can apply from Ontario as well?
Okay, great question. Who from the panel wants to respond? So somebody that's living in Ontario wants to apply here in BC.
So first you need to go through BC IMG clinical assessment program. And if I'm not wrong, about 50% of the spots are for BC residents and 50% for other provinces. You can search BC IMG program. That's the first step. And if you are successful, then you can apply to BC residency positions.
Okay.
Paula, may I just add something?
My question was about the physician associate. It's not for the.
Sorry. I'm sorry. Yeah. So associate physician. So no, they haven't limited it to BC resident. No. And we know that it is not final. We are still waiting for it to be finalized.
Yeah, the government had asked for some feedback as a public consultation. So it hasn't been finalized yet from my understanding, but I don't think that it will be. But Dr. Vahid, you're saying that it's not limited only to BC residents, correct?
Yes.
Okay. Okay, I'm going to go next to Miriam, who has a question or a comment.
Yes, hello everybody. I just wondering why other professionals like dentists or pharmacists, they are highly trained like us, and after they passing their exams, they have a short, like 6-month period of time that they can work supervised, and then they can start their practice. But why for medicine, that is so much different, and the whole life and career of someone will be fake because of this policy? How can we compare this profession? They are also dealing with people's health, and I mean, they are very similar to us, but why the pathway to start the career is so much different?
Excellent question. Who wants to take that?
Can I quickly comment on that? I think if we ask Dr. Blatherwick, maybe he can comment on that too, but that was a question that we were always asking, and we came up to the idea that pharmacists and especially dentists, they're more like a private sector in medical because of MSP and like a kind of publicly, governmentally funded sector. There's more, I mean, government medals in that more compared to pharmacists and dentists. That was the reason that we came up with, but maybe Dr. Blatherwick can comment on that too. And is that correct?
Sure. I talked about talking to your MLAs and your MPs, and I forgot one of the biggest groups, and that is talking to the College of Physicians and Surgeons. And it just reminds me, I had a New Zealand doctor come to see me who wanted to exchange positions with one of my medical health officers. And for him to go, for my medical health officer to go to New Zealand, all they needed from the college was a letter saying that he was a member in good standing. That's all he needed. And he was registered, no questions. The guy coming from New Zealand never got registered. They actually asked him for his high school transcripts. And what I had to do was I suddenly realized I had to get this guy insured. So I made him a resident because I was a clinical professor at UBC. So I made him my resident. So then he fell under the residency program. And then I didn't have to worry about it anymore because I didn't need the college. The college is clearly one of your problems. And when we talk about that, you've got to attack the issue. That is one of the ones that you've got to put together your paper on. You've got to say, this is what you're doing to us, and you're making it impossible. I've been watching the comments, and I under the frustrations that you guys must feel. I get mad seeing what they've been doing to you. So one of the strategies that's got to come out of this meeting is a group of you have got to put together a proposal to the college of why are you making it so difficult? Because, some of the comments have talked about New Zealand, in Australia is much better to go for international graduates. Well, I suspect that New Zealand is also, and I still don't understand why Canada wants to put so many barriers. So That's one of your strategies that should come out of this meeting.
Thank you very much for sharing that, Doctor. There's a lot of people that have their hands up, so we're gonna try to get through some of those comments as much as possible. The next person is Shruti Sinha.
Hi, everyone. I have a question regarding the practice ready assessment. So I would really like to know, how does that work and how can we get there?
Does anybody from the panel want to respond, or somebody else?
Regarding the Practice Ready program in BC, one of the barriers is 2 years of postgraduate training. In Manitoba and Saskatchewan, they need 1 year. But yeah, if you have 2 years of postgraduate training, you can apply to BC Practice Ready Assessment Program. That's for general physicians. Unfortunately, there is no Practice Ready program for specialists in BC.
Thank you. Dolapo Abe. Dolapo, are you muted? Okay, I'm going to go to Dr. Shera. Dr. Shera? I see that you're unmuted, so you can speak.
Okay.
Yeah.
Hi, everyone. Hope everyone's doing well. So my question is there anything specific that the program directors are looking for, which CMGs have, while IMGs don't? So we could work on that. Can someone help me with that? Thank you so much.
Naveed?
I can comment on that. That's CMGs, like, that's the discrimination there, and it's one of the things that Dr. Neil Furshan and I and a bunch of other IMGs are working on it. I would say this is a systematic discrimination there. CMGs can get to residency positions without having passing any single exams. The only exams they have to do is the Q1 exam. But even if we have so many of them, and we have multiple examples of them, that even if they fail that exam, they can still get into residency. And I myself had some fellow residents that they didn't pass any exam and they got to the residency, but IMGs pass all these exams, still they cannot get to residency or practice. This is one of the areas that Dr. Kathy was talking about, Dr. Neil Furshan was talking about, that fair assessment and clear assessment. We really don't know what criteria they're looking for. IMGs, they don't know like what qualification, what criteria they're looking for. They keep changing that year to year, and this is not a fair criteria between CMGs and IMGs.
Thank you for that. And now I have unmuted Dolapo Abe. Please go ahead.
Thank you very much. I have like 3 questions. So for some of us, we couldn't write our exams in the April-May batch. And because of that, it's going to be very difficult for us to go and do clinical observership. I wanted to find out, is there anything that can be done to waive the exam requirements for clinical observership? That is one question. Number 2, what can happen to increase the slots for both family medicine and other specialties for IMGs in the COMS? Because I noticed that there are a lot of, relative to other specialties, there's a lot of slots for family physicians, but very little, almost none in some provinces for specialists. Why and what can be done about that? Then for the practice ready, I noticed that you have to be in the postgraduate program to have at least 1 or 2 years, depending on the province. But there are a lot of people that have practice experience, but they necessarily didn't have to be in the postgraduate programs. In most developing countries, they call it medical officers or just general practitioners, and they have a lot of experience. They've worked for a couple of years, and they are not going to be able to have access to the practice ready program. could there be like a change in the regulations, or could that be brought to the notice of the authorities if something can be done about that? Because if these barriers keep coming up, even people that supposedly haven't spent so long outside medical school, they'll end up having to stay longer, and then they keep reducing their chances of getting matched. Thank you.
Okay, that was a very long question. I don't know if we were able to answer all of them, but we'll do our best. I'm looking towards the panel, or Dr. Blatherwick, if you want to address any of those points.
The first question, yeah, sorry, please go ahead, Dr. Blatherwick.
No, you go ahead.
Okay,
Ed.
okay, sure. So the first question, if I understood correctly, was about the cancellation of exams, and if there would be a problem for applying to clinical observership, I don't know, or maybe residency. So I've heard that there might be some modifications in the upcoming CARMS, the matching system, and they may relax some of the requirements, but I think it's still not clear. In terms of, I think the last question was about practice ready program and the duration of postgraduate training and the value of practical experience, if I'm not wrong. So we hope that there would be some changes, and they will decrease the requirements to around 1 year in BC as well. In Saskatchewan and Manitoba, the experience counts, and that's important. And I think that can count towards postgraduate training as well. And hopefully that would be the same in BC. I don't exactly remember the second question, and I don't know if I answered your questions or not.
Thank you, Dr. Vahid. Delapo, can you rewind the second question you had?
Okay, thank you. I was asking about slots for other specialties in the CARMS. I noticed for IMGs, they have little or no slots for other specialties. And even though it seems that we have a lot of family medicine positions, they still seem to be not enough for the number of family doctors or the number of people that are trying to get into the system. So how can that be addressed? That was my question. That was the second question. Thank you.
Thank you. Dr. John, did you want to try that one?
I couldn't hear it.
The question was about the limited specialty positions in the match system, limited specialty positions comparing to family medicine positions.
The match positions, that's one of the reasons why right now is a good time to be addressing this, is because it's a joke. The thing is, it's money, right? If there were enough positions for Canadian students to fill and IMGs to fill, there'd be no problem. And there is really no problem in finding positions in hospitals. The hospitals would take as much as the provincial government's prepared to give. So the limiting factor here is not the college, which we know the problems they cause for you poor people, this is a money factor. And as I said earlier in my career, places like Saskatchewan and Newfoundland, they were desperate for physicians, and they made space for international graduates. That's really what the long-term solution to this one is saying, okay, let's allow these people to get the training that the college requires. So it's a two-base thing here. It's the additional money, and we've seen in the COVID-19 response, money is no object for government when they want to do something. Mm-hmm. And we've also seen the barriers that the College of Physicians and Surgeons, and particularly in this province, are putting up in front of you. My friend had practiced as a physician in Alberta for 10 years as a GP. He had 4 years at anesthesia training, and to become a medical health officer in British Columbia, he had to do 3 months of maternity because he didn't have a maternity rotation in his internship, even though he'd worked for 2 years in a maternity hospital in England.
Well, thank you, Dr. Blatherwick. I think that that was really the last comment and question that we are able to take on today's call. I think that there's definitely a lot of interest. I think that on the chat, there's been a lot of discussion in terms of the different types of discriminations that people are facing. I think it's really important to take the opportunity now. We know that this is a very complex, but also very political issue. And often we know that that's at the end, it's about power, isn't it? And so this is an opportunity for the collective power and the collective voice to really come together. So we are inviting people to please join the campaign to support and volunteer because as Nada was saying in the chat function, it's a long road ahead. But we do think that because of the context right now that there is an opportunity for some change here in BC. So we encourage everybody to take the survey. We're going to have that up on the chat function one more time. Also just wanted to say thank you everybody for taking the time, hour and a half out of your day, to the panelists for sharing your experience and expertise, and also all of the participants that were able to join us. We really appreciate. We know that there's been a lot of Zoom calls these days, and so we know that it's at the end of the day. You're probably waiting for dinner time right now. So thank you for making this a priority. Really grateful for all of the organizers and all of the people that have been behind the Train to Save Lives campaigns, and just wanted to make sure that everybody understands that this is a volunteer-run campaign and that everybody is invited to contribute. So we look forward to staying in touch on our Facebook pages and other social media. Again, the hashtag is Train to Save Lives. And thank you again for making the time, and hopefully we'll be having an opportunity to advocate and put together the letter that Dr. Blatherwick was speaking to, and creating some other advocacy tools, including sharing this town hall. So thank you so much again.
Paula, before we leave, I just want to thank you for facilitating Nada and Dr. Blatherwick, Dr. Neil Furushan, Dr. Huyan, Dr. Anna Verdi, and Dr. Patricia. And just want to remind everyone that please, if you have questions that are not answered, feel free to send them to traintosavelives@gmail.com.
Great, thank you so much.
Thank you very much.
Do you guys not want to do the second poll?
Oh, we have another poll.
Oh, sorry.
Here we go. Sorry about that. I didn't know we had a second one. So here we go, before we leave.
So the survey is similar to the second poll. It just includes the email as well. So we appreciate if you can fill out the survey, then we will have your emails and we can be in touch.
Okay, and the survey is again back on the chat function there. Thank you everybody for participating. We look forward to staying in touch and working together towards our goal, our common goal.
I think we're officially done. Just want to echo Amir's words. Thank you so much. Thank you, Paula. Thank you to all the speakers and panelists, and obviously, thank you all for joining us. And I hope that this is, in a way, the beginning of our journey together. So please join our campaign and let's stay in touch. Thank you.